we got off the ground before I had left. And so, just even bringing researchers on board, like where are the scientists, where are the clinicians, who's going to be calculating data. I mean, I was hungry for data to know how many 18 to 24-year-olds have licenses, how many females. One of the things that I wanted to see happen was not qualifying conditions, but the conditions. I realize Oklahoma, which is similar to other states, don't have qualifying conditions. However, though, that's data that's helpful, and that was what I wanted to know, is to get a physician portal, which other states have, where physicians actually do all of their recommending directly into the computer system. And so then that way could be an ongoing conversation with providers to incorporate providers, so that patients knew that they were actually getting qualified people to help them. So that way I could find out if, everyone in Enid is having problems with insomnia. Is there a bigger issue there? Like, there should be more public health sharing. If everyone in a 2-block radius that has cards is listing cancer, is there a cancer problem there? Not necessarily just a cannabis problem, a cannabis program there. So I think there's, coming from a public health nursing perspective, there's just so much more that can be generated from that kind of data and that kind of collaboration with the public. It doesn't have to be just a tunnel vision of we're regulating weed and that's it. It's a broader picture.
We had tried to work with Lee Rhodes. This was after our November Patients for Safe Access meeting in 2024.
Okay.
And we had tried to work with him because what we brought up in that meeting was about Superfund sites in the state of Oklahoma, and how geographically, regionally, there are growers that there should be a different type of inspection done just based on the area in which they're growing in, because of contaminated soils and things like that from these Superfund sites. And we had talked with him about, getting like overlay maps done and stuff like that, so that you could actually minimize who did you need to actually affect that way. But it is something that we felt strongly about bringing up to them, because I don't feel like that's something that's considered. In the growing process. Everybody's like, oh, I'm a grower, I got a license. Okay, but did you check the soil?
Correct.
Did you check the water? Did you check these things before you started growing plants? Because hemp/cannabis sativa, is all a bioaccumulator and draws all of that, impurities up from the soil. And then where does that go? But it goes into the flower, and it goes into the product, and it goes into our lungs.
Agreed.
And that was a big issue. I wish they would have had some form of patient services type situation 2 years ago, because it's been a difficult process making the reportings of issues and how they determine what issues to address. Baffles me. I'm just completely bamboozled with it. We have some companies that we had failed products for pesticides that have now been shut down. They've had recalls, they're in administrative actions, things like that. And then we have companies that have had contaminated products that literally you didn't hear of anything at all being said about it, And so I'm curious how they choose to address those issues,
That part I was, I think, more on a compliance and kind of lab carve out that I wasn't part of. However, I do agree with you. I mean, I think there also needs to be education, and those were some things that we had discussed, is it's not necessarily even just patient education. There have been resources put out from other states as far as information to growers, information to processors, information to other lab scientists. I look at it more as I guess what my vision or what my hope would be, and that's not even just isolated to Oklahoma, is that there needs to be some sort of a partnership between whoever the regulatory body is and what they're regulating. I mean, there does have to be guidelines and rules. I completely understand that, but I think when you make guidelines for people without consulting people, it doesn't mean you always have to directly go and follow the letter of what they suggest, but I think you need to ask those questions. I mean, I'm a big one that I don't want a yes man. I would rather have someone, poke holes, give me obstacles, tell me what it is you think I don't know to be able to advance what I think my agenda is. So as many different things, especially if you're growing. I mean, there's some large grows. I know when I talk to people in Oklahoma, they don't necessarily, some, not all obviously, and not even just within the cannabis industry, is they don't understand that Oklahoma products all over the country. I talk to friends and colleagues, Northeast corner. I was just in Denver a couple weeks ago. I heard from them. California, Minnesota is a direct shot up to 35. I mean, it's shipped all over. So even in light of that, in a legacy concept, I mean, you're talking that if people aren't growing in safe conditions, regardless of like the soil, the pesticides and whatnot, that's not always just a local problem. That spreads pretty tremendously. I mean, there is a lot of cannabis per person grown in the state of Oklahoma, more than probably most could assume per person or consume. So it goes somewhere.
It does go somewhere.
So I would agree that I think, even just safety parameters. I guess I spent the 2.5 years prior to coming to OMMA, embedding myself in the community. So in Minnesota, I didn't just stick with the carve out of nurses. I knew how to do nursing. That I didn't need that. I wanted to know who are the growers, who are the processors, how do you extract, what kinds of different ways are you extracting, what are the tips and tricks, who's at that time, Minnesota hadn't gone quite adult use yet. It was just right on the cusp, but who was looking to be in business, so trying to find out all those little niches within the markets to be able to learn all those different areas of like, oh, I have to consider that. Oh, I have to consider that. And I think there's some really knowledgeable people within some of these agencies. However, I think that there are a lot of people that aren't. And without any of that representation within any of these agencies, or at a bare minimum, without any of that liaison or partnership work, you really then aren't going to know even what you're regulating.
So with your nursing background, how many years were you in nursing? Or have you been
25.
25 years.
Yeah.
So in that 25 years, you've been through the prohibition, basically, of cannabis.
100%. Yep.
You've also been through the parts where cannabis has come through legalization for medical and adult use in different states. And so in Minnesota, is it adult and medical?
Yes.
So it is both. Okay. So you wanted to bring that medical background into what you were doing with patient services.
100%.
And would you say that whenever you were in your nursing career, would you say that any time that you had somebody come in with an issue that was cannabis related, whether it was like cannabis hyperemesis or psychosis or anything like that, did the doctors think to know that, hey, it might not be the marijuana itself, that it might be contaminations within that product? No.
The clinician education out there, it is tiny. Most of the providers that I even worked with, let alone any that I would see or meet or any of those things, they really don't know anything about cannabis. And most of them will be the first to tell you. So some of them, even if they bothered to ask, they wouldn't know what to do other than traditional things.
Right.
Yeah, they wouldn't even know to ask.
Did you know you're live on Facebook?
No.
Yeah, you are. I didn't realize that. You're live. I just got
It was supposed to just be recording.
Yeah, so you can end that one if you want to. Keep going on this one. That was a good intro, please.
Right.
Vice versa.
Hey, it's my first time trying to operate Stream Road without the
That's all
hippie. Hey, hippie, when you see this, don't laugh too loud. Actually, we can take a short break. We can go ahead and end this one and pause on that one, take a break for a second, and come back. So,
Perfect.
all right, guys, one love, much love, and we'll be back later.
No, she was just live.
Stay there and that.
I don't know when it picked up though, so
Oh my
it
God.
doesn't look like it was